Assalamu alaikum all. My name is Usman Bashir, and this is my first in a series of video podcasts about radiology and radiological science. The first sign is the Aircrescent Sign. This article was published in 2001, and this describes the Aircrescent Sign as a crescent-shaped or circumferential area of radiolucency within a parenchymal consolidation or nodular opacity. This sign is classically described for invasive aspergillosis. Now, the patient who has febrile neutropenia and X-ray shows single or multiple ill-defined consolidations. Over time, these consolidations will change into these nodules where aircrescent within. Let's look at the images. Now, in this article, they've shown a couple of serial images, a radiograph, the initial radiograph showing just an ill-defined lingular infiltrate, and a second radiograph obtained a week later showing an interval development of at least 2 Aircrescent signs. Findings being in coincidence with recovery of the patient's white cell count. So appearance of this sign in a patient who's suffering from neutropenia and presumably from invasive aspergillosis indicates that the patient is actually getting better. On CT scan, similarly, these images, they show in the acute phase, they show a nodular opacity with a surrounding halo, which indicates hemorrhage into the surrounding parenchyma and has been taken as a sign of invasive aspergillosis. Later on, it shows the development of this air inside cavity surrounding a ball, which is devitalized tissue. The pathogenesis of the Aircrescent sign is that of the hyphal form of the fungus, which invades surrounding arteries and induces infarction of that particular segment of the lung. Later on, as the devitalized tissue contracts into a ball, it gets surrounded by a slit of air, and further outside that air is normal parenchyma. Now, the sign is seen in as many as 50% patients. Differentials to consider when looking at an X-ray which shows a consolidation with an Aircrescent within. First of these is the monad sign, which is actually a fungus ball within a pre-existing lung cavity, such as that created by old tuberculosis. They are frequently used interchangeably, but strictly speaking, Aircrescent sign refers to that acute ICU patient suffering from invasive aspergillosis, whereas the fungal ball sign is a chronic, relatively healthier patient and has a totally different pathogenesis. In the end, I would like to enumerate some of the other causes of the Aircrescent sign, such as pulmonary tuberculosis, pulmonary abscess, and bronchogenic carcinoma. This is it, and I would really appreciate your input in the comment sections, especially if you have a few words to say about the pathogenesis involved in any of the other conditions that have been listed. Thanks a lot.